station is part of the Beasley Best community of caring. Learn more about ways to help fight hunger in your neighborhood. Or, if you're food insecure, find resources at our website today.
Go to your app store and download the WNN app on your Android or iPhone. And never miss a Talk 1470 minute.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. I'm glad to be back with you for the first time in 2019. So thanks for joining us on the radio, AM and FM, and also on Facebook Live and YouTube as well. I'll get right into it. This evening we have Dr. Melanie Rosenblatt here. She is a pain management specialist, board certified in addiction medicine, pain management, and also board certified anesthesiologist. Tripping over a couple of my words today, but we'll get there. Thanks for joining us, Dr. Rosenblatt. How are you doing this evening?
I'm great. Thanks for having me.
Yeah, thank you. And like I said before, thank you for taking us on this adventure of health, because we always learn so much from the doctors we have on this show that take the time to teach us a little bit about what's going on, the latest and greatest in healthcare. Please tell a little bit about what you do. I know you're pain management, but that can encompass a lot of different things nowadays. I mean, that is a super specialized practice. So tell us a little bit about yourself and what you do.
So, like you said, pain management is a wide specialty, right? So we do everything from medication management to interventional pain procedures to medical marijuana, bioidentical hormone replacement. Opioids is really a big thing. When people hear pain management, they want to hear about pain medicine, if they're taking too much pain medicine, if they want to get more pain medicine, if their doctor stopped writing pain medicine. And you may or may not be aware, but July 1st, the laws changed in Florida, that when you go to see your doctor, you can only get a 3-day supply of pain medicine.
That's true.
That's true after surgery. That's true when you go to see your doctor. And so a lot of patients are getting stuck in this place where I need pain medicine, my doctor won't write it anymore, and I have to go see a pain specialist. So that's where I'm getting a lot of my new patients now.
Now, you said go see a pain specialist. So do people have to be referred to you, or is it something that I could just grab your number and website, which we're going to give out in a few, and then just give you a call and get an appointment?
Purely insurance-driven.
Oh, insurance-driven,
So
okay.
a lot of insurance companies require prior authorizations or referrals, so you'll be referred to me from, if you're in an HMO, you'll get referred to me from your primary care physician. But if you do not require an authorization through your insurance, you can come see me, you can call, you can come in.
Oh, nice. Okay, so there's 2 different options there as well. And I'll give out that info a few times today. We said the best number for you is 954-941-556. You'll see that on the screen as well when it pops up. And you've got a great website here that I got a ton of info on. I always get a shout out to the doctors who have good websites.
Thank you.
It's easy. It's your last name. It's www.rosenblattmd.com, and we'll give that out a bunch as well. Now, we obviously have a lot of huge baby boomer population in South Florida. In fact, nationally, we have a huge baby boomer population, as well as senior citizen and geriatric population. Seems like I read an article. There's more people moving to the state of Florida. We're now the third most populous state, and we're right in the heart of it down here. So, what age range of patients do you treat? And the second part of that I'm getting to is how can you help the baby boomer senior population?
So I treat 18 to 108.
108? Yeah. Wow.
I have 80-year-olds come into my practice, and they think that they're old, and I tell them in my practice 80 is practically pediatric.
Yeah.
So yeah.
I was just looking. Also, I read a lot. I'm a news guy. 112. There was a lady that's 112. That's the oldest lady in the world right now. So you have a patient that's 108. Wow, that's impressive.
Love them.
I had to throw that in there. So 18 to 108. Do you focus on from that 18 to 108 age range? Is there a bigger age range that you treat than others, or is it kind of just mixed?
Well, it's actually pretty well mixed. I'd say I see a huge amount of seniors.
Okay.
Yeah.
And these are people seeking your care because injuries, arthritis, trauma, day-to-day better quality of life.
Yes.
Check all the boxes.
Yes.
Yeah, definitely.
Most of what I see is low back pain.
Oh, yeah.
Right. So whether it's spinal stenosis or a herniated disc or still with pain after multiple surgeries, I see a lot of low back pain.
Yeah,
but I also see a lot of cancer pain and trauma, pain from trauma and headache pain and all other kinds of neurologic diseases. And if it hurts, yes, you can come see me and we can try to find a way to make things better.
That's great. And going to the lower back, and I want to get and talk a little bit about the interventional procedures you do as well, but lower back pain, do you see that? You said spinal stenosis, but do you also see a lot from weight, like someone who's, a bit overweight like myself, well, actually a lot overweight? Does that cause lower back pain, or it doesn't matter? It could be someone who's looks like they're in the best shape of their lives and, doesn't have much fat on them. They could show up with lower back pain as well.
So we can't see pain, right? So you can't tell from looking on the outside how much somebody's actually suffering. So, one of the first things I would do if you came to my practice is order an MRI, see what's going on if you had back pain. And certainly, of course, the weight's not going to help it.
No.
So if you have pain, most physicians would recommend, losing weight could help. It could help a lot. But you may still have an underlying structural problem. You may have a herniated disc. You may have a pinched nerve. You may need an epidural, a steroid injection of some kind. It might help.
Okay. And let's talk about those interventional procedures. Epidural, steroid injection. Can those be done right in the office, or does that have to be done at a specific center or hospital? Or
in my practice, I do them mostly in my office, where I have a fluoroscopy, a C-arm, where I watch the needle going into the exact space under real-time X-ray beams.
Oh, yeah.
It's very, very cool. It's very high-tech.
You can't beat that.
Yeah.
I mean, that's... So, when is an epidural needed? That's obviously some very severe pain. It's become a problem that people can't even have a quality of life, right?
Right.
Wow.
And there's all kinds of epidurals, and there's injections that aren't epidurals. Like if the pain is not coming from the epidural area, it could be coming from the facet joints. And the facet joints are a very common area of chronic pain in an aging population. They get degenerative, they get arthritic, so putting some steroid in those joints can help.
Okay, where are those facet joints located?
In the spine, where they overlap, where one spine, where each body meets the next. So they're responsible for flexion and rotation and motion.
I knew I'd learn something here tonight. We're here with Dr. Melanie Rosenblatt, MD. She's board certified in anesthesiology, so board certified anesthesiologist. Pain management she's board certified in, and addiction medicine. Her website is rosenblattmd.com. That's rosenblattmd.com. Now, you're right. You have two locations. You're actually here in Boca Raton, where the studio is, and then you also have a location just over into Broward County and Pompano Beach as well.
Yes, on Sample Road, right off 95.
That's great. And then in Boca Raton, North Military Trail, 2900 North Military Trail, number 241. So those are two great locations where people can find you at as well. The number's 954-941-5556. And you can always check us out on Facebook at allcountyhealthcare.com. All the shows are there. under the radio show tab, and then also on their website, which is also allcountyhealthcare.com. You'll find a catalog of shows there as well. And we talked a little bit that you do take insurance. You do also take private pay.
Yes, I do.
If that's the patient's choice or whatever works out for them. Does Medicare cover any of this?
Medicare covers most everything.
Oh, nice. Good to hear. Because I know one thing about aging is I'm only 41, but I start to feel the effects. I mean, things don't work as well, and there's a lot of pain as well. Now, another side of things, you also are one of the esteemed doctors that can help people out with a medical marijuana card if they're seeking that. How does that whole process work? Because I got to tell you, I've had a few doctors in here, and it still confuses me a little bit how the whole process works. So someone goes to see you. Do they have to have have an underlying condition to get this card, or is it just your recommendation? How does that whole process work?
It has to be recommended by a qualifying physician, which I am.
Okay.
You have to have one of several qualifying diagnoses, and they're listed in that brochure, but it includes things like MS, chronic non-malignant pain is one of the diagnoses, and that's where most of my patients fall into. Cancer, pain.
Epilepsy, glaucoma, I see here, HIV, AIDS, PTSD, post-traumatic stress disorder, ALS. Mm-hmm. So is that amyotrophic lateral sclerosis?
Very good.
Crohn's disease, Parkinson's disease, MS, like you said, chronic non-malignant pain as well. I had one doctor, I feel like they said even if you had sleep apnea, that may be something that would qualify. So the people go and see you, and if you feel like they can take the next step, you then let the state know?
Basically, I register them on the website. They get what's called a P number, a patient identifying number, and then they complete the application themselves, either online or submitted by mail. And then I provide the recommendation and the prescription, for lack of a better word, in the system. So that when they go to the dispensary, they can go pick it up.
Okay, so there's your notes there on the recommendation.
Right.
Okay, got it. And so people can pick up this brochure at your office then?
Yep.
So it's a medical marijuana brochure. It's called Pain Management Strategies. You'll see Dr. Rosenblatt's nice picture on the front, and you can pick that up at either of our locations in Pompano Beach or Boca Raton. Hard to believe we've already ripped through 15 minutes. Isn't that something else?
There's so much more.
Yeah, there is. You're going to have to come back again. RosenblattMD.com, numbers 954-941-5556. Let's take a quick commercial break. And on the other side, I'm going to talk to Dr. Rosenblatt a little bit. We're going to go into depth in a little bit more of the procedures she does on the You and Your Doctor Living a Longer and Healthier Life show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization. no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back. We're here with Dr. Melanie Rosenblatt, rosenblattmd.com. She's a board-certified anesthesiologist, pain management specialist, and addiction medicine specialist as well. Pain management strategies live life better. 2 locations in Boca Raton and Pompano Beach. The number's 954-941-5556. We talked a little bit about medical marijuana and your practice as well. Now, this is interesting, the testosterone pellets. And I see a man and woman on the cover, and I'm going to let you pronounce it because I'm going to get it wrong, but it's bioidentical hormone optimization for men and women. What is that? And if you'll say the word.
BioT is the company that makes the pellets and the process.
Nice.
So what we found is as we age, we lose our testosterone levels. But what's also what brought me into learning more about this is when people are on high doses of opioids, that reduces their testosterone levels, much the way that steroid use when you're younger would reduce testosterone levels. So when I started testing my patients and found that their testosterone levels were low, I wasn't all that surprised. But when I learned that BioT has a method where we can actually replace the lost testosterone and get people feeling better, better mood, better sleep, better sex drive, just feeling better all around, and it improves their pain as well.
Seems like a lot of Americans are cruising around not feeling well, if you ask me.
No, everybody's tired and overworked and sleep deprived and in pain and not getting enough exercise and not eating well. And
now, is this actually a prescription that someone has put on and they see you to get the prescription and then they can take it over time?
No. The way it works is they see me, we get the blood work, and then you come back. The blood work takes a day to come back. You come back, and we come up with the right dose for you, and then we make a tiny little incision in your butt cheek, and we stick the pellet in there.
Oh, wow.
Yeah.
And then it's in there until it dissolves?
6 months. 6 months for men, about 3 months for women, because men have a lot more testosterone we're putting inside, so it lasts longer.
Wow, and you said this can help with energy and fatigue. I see you're also here difficulty sleeping at night.
Yeah.
Boy, everyone has that as a problem in their adult life one time or another. I've been there.
Yes.
Wow. That can really mess with your mind. Helps with mental focus and memory. Moody, anxious, or depressed. There's a whole different things. Weight gain.
Yeah, it helps with that for sure.
Wow. And then this just dissolves in the body.
Yes.
Unbelievable.
And
is it painful at all? Do people say they even feel it, or do you put a little local there?
Yeah, I put a lot of local there. So the procedure itself is fairly painless, I'd say. But sometimes the next day when the Novocaine's worn off and you've got the pellets inside, it's a little uncomfortable for a day. I say ice it for a day or two, and then you'll be good to go.
Yeah, and this can be done right in the office as well?
Right in the office. Yeah.
On someone's lunch break or if they have time?
And testosterone is for men and for women, but also for women is estrogen.
Okay.
So, postmenopausal women who have lost estrogen, replacing estrogen can help prevent the bone loss that happens with age. And, of course, it helps with hot flashes and moodiness.
Definitely. And say it again.
BioT.
BioT.
Yeah.
And you can find that at Dr. Melanie Rosenblatt, rosenblattmd.com, locations in Boca Raton and Pompano Beach as well. Now, this is interesting. I didn't think that, I mean, I know pain management specialists do procedures because I know about the epidural and the interventional procedures, but this is interesting. I see HF10 therapy here, but you described it as something else.
Spinal cord stimulation.
Wow.
Yeah. That's probably the coolest thing that interventional pain management has to offer. So it's basically like an epidural catheter that goes into the epidural space, much like a labor epidural would.
Uh-huh.
So we do the trial in the office just like a labor epidural, and we tape it in, and you get to wear it. Like literally you take a test drive for 3, 4, 5 days. And during that time, you're in touch with the rep, frequently every day, if not more often. And your pain gradually, if it's working, your pain will get better and better and better as the days go on. And then when you come back into the office for a lead pull, or when we actually just pull it out, it's like taking out an IV catheter.
Wow.
We have a conversation. How much did it help? Did you like it? Did it help you?
Goes, it's like a stimulator that goes below the spine, then it's hooked into...
It goes under the skin into the epidural space in the spine. So for the trial, it's just taped in, and you carry it's plugged into a box that you wear in a belt loop, in a belt holder. But when we go to put it in permanently, we take the lead out for the trial, and then we schedule you in the operating room for the permanent placement. And that's 2 incisions, 1 incision where the lead goes and 1 incision where the battery goes, so the whole system is underneath the skin.
Unbelievable.
It's very cool.
And this is something that obviously is pretty new.
It's not new. No, it's not new.
Okay,
it's something I learned about in my training a long time ago. So I've been in practice 23 years. So it's been out for quite a while. The therapy, though, and the technology keeps improving. And it's gotten to the point now where the most recent version of spinal cord stimulation is this HF10, the high-frequency stimulation. And I think it's the best thing I've ever experienced for patients who are appropriate candidates for spinal cord stimulation.
Oh, wow. And how does it work? What does it do? It relieves pain?
It overrides the pain signal. So it basically confuses the nerves in the spinal cord to not send the pain signal. So it works very well for neuropathic pain, nerve-related pain, for post-laminectomy syndrome, patients who've had multiple back surgeries and still have pain. It works for shooting leg pain, radicular pain, reflex sympathetic dystrophy pain, or sympathetically mediated pain, all kinds of pain syndromes that are complex and really require, it's another level. This is not your, Tylenol number 3 kind of pain.
And how long can this stay in a patient?
They're rechargeable, and they last about 9 years.
Whoa.
And then it's just a simple battery change, like having a pacemaker battery change.
So if all goes well, you wouldn't have to have this actually maintained for 9 years.
Right, and the best part is, if you have pain and you're on opioids and you come and you have this test and it works and we put it in, we can get you off opioids.
Oh, yeah.
It's fantastic.
That is great, because for everyone on those, that can be tough to get off, because they mess with all kinds of issues with your internal system, huh?
Right.
And into the brain as well.
Yep.
Is that Phil Collins on the front? Looks like Phil Collins. So. I was like, did Phil Collins have this? Another great brochure if people want to learn more. I know about deep brain stimulation programming for Parkinson's disease tremor. I've had a doctor on for that. Yep. We've had doctors on who, the pumps in under the skin for, people with diabetes levels.
Insulin.
As well. We even know that Jay Cutler played with the Miami Dolphins a few years ago with that as well. I had never heard of this. I told you that we're going to learn something new on this show. That's why we have the best doctors around on this show. This is amazing. So if people want to learn more, they can just find you. Let me give out the addresses this time. It's 1 Medical Plaza, 1 West Sample Road, number 104. You said that's right near I-95, right? That one?
Yeah.
Pompano Beach. And the number there is 954-941-556. It's Dr. Melanie Rosenblatt. And right here in Boca Raton, Twin Lakes Professional Center, a little west of us right here from the radio station, 2900 North Military Trail, number 241 in Boca Raton as well. The number will work for both.
The number works at both
offices. I know you have a 561. And then rosenblattmd.com if you have any questions. But just go to our office, check out these brochures of the latest and greatest in healthcare. Say again what this is.
Spinal cord stimulation.
Spinal cord stimulation, that's what it was. As well as medical marijuana. And let me see if I can get this right. The Biote. Biote. Almost. That's just how it's right there. Excuse me, as well. That's for that's the testosterone pellets for men and women. And this medicinal cannabis. Now this can be CBD. I know I did a little research on this, sativa and indica, or as well as there's a 1-to-1 that's kind of the blend.
Right.
As well. So that's everything's in a vaporizer form or topical. Sublingual, I'm sorry, not topical. Some of the things are topical though.
Some are.
That people can rub into their skin. But obviously, you're the expert. Someone can call your clinic and talk to you, or your staff, and set up an appointment and ask you all the questions I just asked you.
Absolutely.
Again, that number is 954-941-5556. I told you it was quick. It's like really quick.
There's so much more to talk about.
I know. We got a lot done, though. But let's have you on. I have some open spaces in March, so we'll work on coordinating you.
Well, thanks so
for
much.
the show. Thank you so much for coming on the show. And
thank you.
We learned so much. It's RosenblattMD.com, Dr. Melanie Rosenblatt. We'll see you next Tuesday on the You and Your Doctor Show, living a longer and healthier life.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.